Hey, I'm suing.
We get
I should get prison. I'll just write you a tissue faster like that.
I would, Amy stretched mine out, I can't feel it.
So what was that now? Debt happens after deficit.
Right.
I didn't know there were different words. I thought debt or deficit, you're like, you're out of something or you're.
Yeah, you're erratically breathing, so you're running.
Craziest thing I ever heard.
Yeah, it does get that, when you're breathing erratically, so you don't want oxygen, and when you're done,
You gotta pay it back, cause you're in
Well, I'm
debt.
starting to breathe a little like rat meat.
huh?
I thought that was like that ESOP thing, you gotta make up your heresy.
Yeah. When the things do
Oh, look at that discussion.
Now.
See, that's how I'm gonna be this board.
Let's just throw more technology at it here.
That doesn't fix it, nothing.
Hey, I'm not gonna leave it this way.
Okay,
Let Jim go movie theater.
I'm getting busy.
Move your lectern out, and then like it'll sit.
Well, good job now, while I'm in a bind. Move the lectern.
Can't read a thing.
Maybe.
It's gotta get bigger, huh?
Yeah.
That doesn't help at
It's
all.
not so much the whole picture, it's the words that need bigger.
That's not much bigger than,
Is there a plug-in right there? Alright,
There's an extension cord attached.
this is gonna be hard on my, unplug it over there. I'll go over and find Jim. That way he can.
It's not better than the lady beside
I don't know if it's that or that.
I don't know if your hatred poker today,
Might be red.
but
Tomorrow I'll trade.
dip it in the mud.
Because I think you can take it, I don't know.
Cause
Here's,
I'm kind of
here's the
feisty.
deal, I'm trying to build her up, and I think you're too big. It'll tear you down and nip you down. She'll level it out.
You call her a two-bit hooker?
No,
Does this go with
I
this, or
called
is
her,
this going together?
one bit.
It goes
I thought you said you're a two-bit
No,
hooker.
I know, because that's being honored to her today. And so once you made a comment about it, then you gotta just keep being honored, right?
Yeah.
So I said, well, I'm not sure, because I'm trying to build her confidence up. I said, but you're too confident in yourself.
Too confident, I thought you said a two-bit hooker.
No.
That's the worship slide.
No, I mean, she is trying to pop her boobs out of the
Yeah.
Blew the bowl.
There we go.
Nick Morris does.
We're losing them.
He had to go to work.
Listen, everybody's walking out, I'm gonna set this up.
Hey, we're still.
Whoa.
my kid does.
I thought about it, my kid, you just shut it up. How old's your kid?
He's 12.
Mine can walk home. She's 2.
Mine's,
Mine's
11.
6 and 2, so.
I'm sure somebody will pick her up.
Less money.
I am kidding. I am kidding.
I know.
Whatever.
I know. You wouldn't even let her sit
I
down.
taped a note on her shirt that said, please take me home.
No.
Is this better?
Yeah, but it's Wednesday, it's gonna be.
We can't miss it now.
Is it like a focus?
So I gotta take
Felicia?
it down.
What?
You see?
What, I'm sorry. Yes, I can read it.
Maybe I just need glasses. No, I mean, I really do need.
You're not getting mine,
I don't want.
because I'm blind as bad. Alright,
A to B is really bothering me.
I have a headache
Never
anyway.
find, mine is
My
not
good
that
Lord.
anymore.
Thank you.
Wow, the black words didn't disappear.
do you need me to bring you a soda too?
I
I'm
got
not
popcorn.
caffeine dead
Alright.
right now.
Yeah.
A patient is beginning a resistance exercise. We already did that one, didn't we?
Yeah.
Yeah, around 6
play soccer in the clinic, die contusion during her treatment. She asked about muscle fibers. You notice that she has a great deal of quad strength and she has an impressive bilateral hypertrophy in her quad. She's an average height female and has been playing soccer and other sports most of her life. This observation would suggest which of the following muscle fiber types? All.
Yeah, you said like this.
Only 80, less than 80% of the people heard. You are using a pool for therapy on a patient with fracture in their left tibia. They have orders that are non-weight bearing for 6 weeks and ambulate with axillary crutches. If they swim laps for 4 minutes, what energy system? There you go. Taken oxidative phosphorylation. Anything over 2 minutes goes into oxidative phosphorylation. New cabbage patient, plan of care, 15 minutes stationary bike. Where is their blood going? Muscles that are exercising, including their heart.
What are you doing?
Apple does not work with Blackboard very well. And so I had to break out the old technology and get this.
I worked fine this morning.
It gets bigger on there.
It was kind of small.
No, that's not here. I'll let you see it so you can deal with this. Okay. Wolf's Law is best applied. Key word there is best. What's best? I told you running was better than walking. And an exercise program with static loading, what would that be? Yeah, pretty much. You're doing static load right here. Now, which one's better? We never even talked about supplementing calcium. Nor will we. When core temperature rises and blood is diverted to the skin, this is cardiac drift in its finest form and fashion. Core temp rises, blood is diverted to the skin, heart rate is then elevated to compensate for the change in stroke volume and to maintain cardiac output.
Got that wrong.
Working fine for me there, KB.
You got it up?
That's not the one I want.
No, it won't do it through that, you have to go through this one. You want the percent answer and all that stuff on it?
Yeah. I mean, I don't have to have it. I don't think they really necessarily need that. I wasn't even able to get that up earlier.
I had to go, I went through your assessments tab, click on the test.
Edit the test.
And you're honestly on medication.
Well, I don't have to do there.
I'm watching you on camera.
Are you,
Man, what's he doing?
are you mic'd?
You are. That's a good solution, by the way. It's gonna work.
What?
That, no lapel mic. I can hear everybody talking. Cool.
Which one you want, sides or the middle?
Middle. Stick with the middle.
Alright. You are in acute care unit treating a 22-year-old female bilateral extremity injury and a right wrist fracture. That is a ORIF and non-weight bearing. I realize that some of you were like, what's non-weight bearing? Well, certainly if she has a right wrist fracture that's ORIF, that's not going to be weight bearing, but the non-weight bearing had to do with the lower extremity. Which of the following exercise protocols could you do? Which one could I do?
Well, but kind of the way that it's worded,
The way that it's worded, I
you
was
can tell
thinking,
if it's non-weight bearing for just the wrist, or if it's non-weight bearing for everything. And
Well, I know, and
got that,
when we were asked, what did I tell you guys we could do? I said non-weight bearing for the lower extremities.
Didn't you tell us that if something's fractured, you want us to work it though, so we can do exercise?
Well, it's in an ORIF, so you can't move it. That's the first contraindication to movement, is open reduction internal fixation. Means that they have this thing right here, and you're not moving it.
Yeah, it has like, just like.
I mean,
stuff
this
in
is
there.
out of the skin, pins and a bar right here that they use. So you can't move that. Non-weight bearing means you can't do weight bearing exercises, which eliminates walking. Having the patient perform active bilateral lower extremity exercises only. Active exercises with the right UE in all joints, can't do it because there's a right wrist fracture at ORIF. So the only option you have is active exercises with the left. Now,
That crossing over.
that's the cross education. And that's what I was hoping that would be like the first thing, you'd be like, well, I can always do cross education. This question, a patient losing weight, it's imperative they do so, they go on a low carbohydrate diet. What will the primary energy source be while it lasts?
I missed this one.
I
I
did
missed this one.
Because, can I tell you my reasoning on that? Okay. I thought when you burn these things, it goes carbs, fats, proteins. And so, in this question, it says, they decided to go on a low carbohydrate diet. What will be the primary energy source while it lasts? So carbohydrate diet, I was like, well, where they're running out, so they're gonna use up this, when they're dancing, nonstop, so I put carbohydrates. I got it wrong.
That's what I was thinking.
That's my reasoning.
We got the proteins.
I was like, well, they're gonna use this up.
Well, I thought cause it's low carbs, they's out of carbs, so.
Well, when you said primary energy source, I wasn't sure if you were saying that was like the first thing that they were using, the initial, I mean, past the
Right.
anaerobic stuff.
If you're on a low carb diet, would you have you would have carbs left to burn, right?
Yeah, it didn't say a no carb.
Right,
So, and I agree, this was misleading in that sense. And so, as I told someone else who obviously didn't spread this knowledge, they kept it from you, that I'm going to give this question back.
It would be one that I got right.
You said what now, what'd you just say?
All right, now I got
You
no
are?
plus.
What did he say?
Give it back.
Right, we're rolling in a positive direction.
That's better than what it was going.
During an exercise for the knee, you flex the knee and flex the hip. Which of the following is an agonist in the hip region? When you flex the knee, what's the agonist? But if you just went down and said, which is the odd one out? Glutes, semitendinosus, and biceps femoris are all posterior muscles. Psoas is the only one in the front. Just simple, just look at those and say, I will tell you this, one of the best pieces of advice I had going into any of my big tests was read the question, and before even looking at those answers, you immediately answer, okay, this is what the agonists that do that are. So in the knee and in the hip, these are agonists for this motion. And before I even look down, I have that answer in my head, and so I match it close to what I know it is. And so that really helped me. I don't know if that's something that's good for you. A male has very low fat mass, but also has very low muscle mass. Has a great desire to make some significant changes and has been working out for around 3 weeks. According to your knowledge of neural adaptations, which the following statements are true to make?
I was like between 1 and 3.
I don't have anybody want to say? Leave me alone? Really?
Well, I said wrong.
Makes me want to consider what I was going to offer there.
What did you say? I missed it.
Make it bonus points.
What did you say?
What? I didn't say anything.
Oh, okay.
Oh, I have a problem, you should make it bonus points.
I'm throwing that one out. And I'll tell you why I'm throwing that one out.
Why?
Because of this right here.
What? So does that mean we're done?
Yeah, that's what I picked up.
And what did I tell you right
You said
before?
you don't
I told you guys,
That's why.
strength, no, hypertrophy, no. It's all about recruitment. And I'm gonna go back and change that. As a supervising PTA, I hope that this one didn't treat you too bad. They're doing wall squats. So they're doing something that's isometric. And what I hope you know now is isometrics are the leading exercises that involve Valsalva maneuver. They're holding their breath on the way up. The patient, well, they're doing wall squats that are isotonic, so never mind. The patient is 3 weeks, status post right knee and mastectomy, and is really struggling with exercise, but is able to get the desired range of motion repetitions. They appear to be sweating a great deal, which means they are diaphoretic and have a slightly elevated pulse. You also check their blood pressure between sets, and they have an elevated systolic pressure from resting of 117 to 145. What's your greatest concern? Yep. You have decided to begin an aerobic training program after a week in the sniff. Said your scrubs were looking tight in the pants. That's also actually supposed to say a nurse said that your scrubs were looking tight in the pants. Oh well. When you begin to walk 30 minutes every day,
Everybody got it right.
then eventually 6 weeks, not everybody.
Well,
Yeah.
might have picked the wrong right answer.
They picked 42% picked the wrong right answer, but now everybody got it right. It's a
I can't
decrease.
see what it says now.
See, it says that the first one was right, and I picked the first one, and it gave it to me wrong.
I don't know which one.
I should have corrected everybody's, but if I
But it wasn't in
didn't.
that order, they was the first and last one on
I
mine.
got
Oh,
that marker
okay.
on too.
See what I'm
What's the
saying?
matter? Why'd you move my deal?
See, mine was AB.
I didn't do anything.
Come on, Jim.
Quit hitting the table.
Darn it, Jim.
So you're a Trekkie too, huh?
Uh-huh. No. You have a new acute cabbage patient. Which of the following exercises would you not do? 100%. I'm not even gonna look at those. Right biceps tendonitis and right shoulder that began after she competed in a weekend volleyball tournament. She will use which of the following to catabolize proteins for energy? Amino acids. Osteoblasts are responsible for reclaiming calcium for metabolic processes and removing damaged bone. False. You know what are? Class. You have decided to use the indoor pool for a month for a 1 month status post carpal tunnel release. If the patient swims laps for 12 to 15 minutes, what energy system would they be using in steady state exercise? OP. Cabbage patient. I'm gonna hop today.
Yeah, I'm told. Awesome.
You can read it up there, Jim.
I got that one right. Okay.
All right, cabbage patient in phase 3 cardiac rehab. They are 54 years old, have progressed well. What is the correct response of their diastolic blood pressure during their 20-minute ride on the stationary bike? No change. An acute response from blood pressure immediately following resistance exercise and into the rest has to do with volume is rapid drop from peak.
And that's because it's resistant exercise. Is that why? Is just because it's resistant?
Yeah, but this question stemmed from this right here. I walked right over here, and I can almost still see it.
You were talking about that with the Valsalva though.
Yeah, I know.
5%
They wouldn't
got that one right.
necessarily be doing that if they knew it.
Okay, but look at the question. Following, hang on, I'm right in the way. An acute response from blood pressure immediately following resistance exercise and rest.
68%.
I thought that just had to do with the Valsalva.
Well, that has to do with
You were talking about.
resistance exercise. What I was saying was the reps. I know, but I was trying to say, this is reps, and this is what your blood pressure does in reps, right here,
Like in lifting weights.
in lifting weights. This is what blood pressure does with lifting weights. The Valsalva maneuver was that it would actually do this, and what your blood pressure peaks would be somewhere at this level.
I never put them two together by
So-
Salvo and lifting weights.
Nobody else did.
Like that. So we need more talk about Valsalva maneuver and lifting weights?
Well, resistive exercise, I didn't,
Well, and,
I didn't put the two together at
listen,
all.
you guys need to know that the direction we're going, I don't know if many of you have looked ahead, is we're going to spend a lot of time, talking about resistance exercise, and or anaerobic is what we're gonna call it, and then aerobic. I mean, there are one section devoted to that, and I'll really dive into
So, in anaerobic, it would shoot up like that?
an anaerobic, which is resistance.
Like anaerobic, like a sprinter does like 50 yards, 40 yards, when they do the 40-yard sprint, would it then?
No,
'Cause
not as
that's
much there.
anaerobic.
It is anaerobic, but what I'm saying is I call that section anaerobic because we are talking about exercise, specifically resistance, that doesn't need a lot of oxygen.
Okay.
So that word rest is supposed to be reps, is that what you're saying?
No, I should say rest. And I'll think about that question because of this reason right here. Clearly, that's one of those ones that said the difficulty level was,
You still don't understand all this exercise.
We're working it right into a high D right now, man. Keep it up.
Yeah, I can't catch a break.
at the time of an immediate stretch of a muscle, which of the following causes an excitatory response to contract the muscle? I hope that's good with everybody. I mean, this, honestly, I was disappointed in this number. Because that was one thing we spent quite a bit of time on one morning, and then we dedicated an entire lab to it. So I expect that this will not exist
I got that one.
right here. You're stretching a patient with a 6-week status post total knee arthroscopy. Arthroplasty.
SP is status post. I
Status
had no
post.
clue, so I just started going past it.
Well, ask. Listen, I need you guys to ask. If you don't understand a word,
Oh,
ask.
cause I felt like, man, he thinks we should know this, or I should know it, and I didn't, so I didn't.
Well, yes, I do think you should, because it should have come up in either somewhere in
We
intro
felt like
or,
post op or something.
somewhere maybe around midterm. I expect that that is something you know, and if you don't catch a term, or if there's an abbreviation that you don't see, and you're like, what is that? Ask.
Okay.
Because wouldn't you much rather know it, or kind of feel a little bad about not knowing in front of me, as opposed to your clinical instructor in a few weeks?
Right.
Yeah, I mean, I want you to feel okay. There's no judging here if you don't know a certain term. That's what I'm putting them in there
I
for.
struggle with the.
So you
next
see
one.
'em? Like this, I heard, and I'm not picking on you. I don't even remember who said it, but somebody said arthroplasty, or no, arthroscopy. Well, you hillbilly, it's not arthroscopy, it's arthroscopy. You're putting the emphasis on the wrong syllable. Okay? And this is important, that you don't walk in to your first acute care clinical and the surgeon's standing right there who did the work, and they say, how you like it? And you say, I think you do a mighty fine arthroscopy. Okay? Status post, arthroscopy. I mean, I want you guys seeing these terms and knowing how to pronounce them. And then also being able to use the lingo, the jargon. He has PT goal to obtain full extension in his knee and lacking 3 degrees during the stretch. You're anticipating which physiological response to occur to facilitate the desired outcomes of the therapeutic intervention, and that is Golgi tendon organs firing and allowing a stretch to occur. All 3 energy systems are active at one time.
What's up with that one?
I didn't know that, bro.
If you go back into your notes and you look, what it will tell you is that you are always in, even at rest, oxidative phosphorylation. When you kick it up into anaerobic stuff, specifically ADPPC, ATPPC, and then on into glycolysis, if you maintain it, you have to fall into a steady state, which is oxidative phosphorylation. But energy systems are always working together. and they require each other to move forward. One predominates though. If your intensity goes up so hard, so fast, ATP-PC, then glycolysis, and then you're gonna fall back into oxidative phosphorylation.
The way that sounded was like all three are running at all the time. That's what I got out of it.
Well, you're gonna use all three.
I understand that, but from what I understood, the way you're telling us, is that the PT, or PTC, or PTA, PC went first, and then the glycolic, and then the oxidation
That's
for
what I thought,
everything.
they were
and then-
split up in
And then you
sections.
ran on that until you ran out of that, and then you went on to something else. But
Yeah, we thought that's why
Not
there was
really.
the timing of like 0 to 2 seconds,
yeah, you got
10 minutes.
or 2 minutes for one, 3 minutes or more for the other, and then, so that was,
This is in all three. During resistance exercise, large increases in both systolic and diastolic can be seen. Now,
Nobody got that question right.
Yeah, you should totally.
this one really
That was bad.
blew me up. And what I'm saying here is,
Is it possible?
I remember very clearly saying 350 over 250. I mean, I remember
We
saying,
didn't put valsalvic and
Right,
resistance.
I thought,
Yeah.
We didn't at
yeah,
all.
I thought he
Well-
was, what if he's breathing properly? Like, I thought the question
Yeah.
was a little vague.
I
but
think for a normal
Valsalva, it doesn't
situation-
need resistance attached to it to still be existing, okay? I didn't even really need you to worry about Valsalva. What I needed you to worry about is this word right here. In a true and false situation, and this, I wanna tell you, I feel like I'm gonna preach in a sermon here. You don't get true and false questions on your licensure exam, which ultimately is what matters, but this is not an absolute. I mean, and what I need you guys to go forward with after today is resistance exercise, by far the hardest on blood pressure. I think we're all starting to get there. And it may have came at a penalty, probably more to me now than to you, but, so, obviously I cannot let this go, right here. Jim,
it's,
now where you at?
I'm looking good.
I'm telling you, he's not gonna go cry.
He thought the resistant thing did high blood pressure. I had some high blood pressure earlier, but now it's
You
going
did
down.
you do any resistance, any Valsalvas?
Yeah,
He
I was
was
holding my
breathing
breath
that
when I
time.
started reading it the first time.
I understand. Green six fracture, it's now absorbing the dead bone, those are osteoclasts.
That was on her class.
It was?
Yeah, but that's okay.
I'm just glad I got her out.
Yeah.
I got two of them though, if I missed it.
That's why this says copy of. Why did it do that?
That's what confused Blake so much.
See, if he would've said something, I'd have said, don't answer it, I'm gonna go in there and kill the question.
Are you taking that one question off that we all sucked up, or you just,
Yep, 100%
okay?
didn't answer it right. That just kinda, I guess at that point, that has to reflect on me. But,
Well, I think I overthought it also, though.
There's a true false question, seems like somebody gets true.
yeah, you won't be seeing many more of those on my watch. Don't worry about it.
No more easy questions that will on this.
I'm gonna drop that hammer with the date. Wolff's Law is best described by, did you like this one?
I got that one.
A runner will increase bone density in the lower extremities.
I put one.
A weightlifter will increase bone density of the areas of the body he uses in weightlifting. A swimmer will not, and a cyclist doesn't see much. You are teaching a patient how to ascend and descend stairs with an ambulation aid. While descending, they are having an eccentric contraction from the unaffected quadriceps. Huh?
Tap in teaching.
Now, this question really required you to go over some interdisciplinary boundaries, didn't it? You had to go back to intro to PT
Right.
and say, oh my gosh, how do people ambulate with crutches? And remember, I'm almost certain, because I do it every year in intro to PT, when they're doing crutches, I walk in there and I say, I promise you're going to need to know this in TheraX. And that's the question that delivers my promise. I prophesied it over a year ago, and
I
you guys were like, Kendall's blowing smoke.
I remember that.
I'll do it again. This year, I'll go in there and I'll say, you better know this. The human body cannot create energy. That was right out of the notes. I mean, it just says it just like that. A 42-year-old total knee arthroplasty is working at a level of somewhat hard. Now, if you go back to the notes on Borg's level of perceived rate of exertion, what I did there is I said, here is the number, 6 through 19. And y'all were all like, why 6 through 19? And I said, this has to do with normal resting heart rate. And so all we did was we came in and we said, okay, who cares what their age is? Normal resting heart rate, they're somewhat hard, somewhat hard. I told you, I said, know this one. 13. Know this one.
70%. So I actually calculated that, and it said it was 123 or 124, so 70%, which is somewhat hard.
Well, you were using max heart rate. And I just wanted you to use the intensity scale of Borg's. Just
That's why I was like, I'll just round up, I guess.
anytime, and I'll tell you this, if I wanted a max heart rate percentage, and pretty soon that will come up.
See, when I first asked, that's what I thought you was asking.
Okay.
That's what I was wanting to know. So I just saved it, when I took the test, when I went back to it, then okay, it makes sense. I
Yeah.
can't tell you why.
And here's the deal, that's the one I want to lean on the most. And it's pretty important that you kind of figure out, okay, what is their average, or what is their somewhat hard? It's about this. That's if they're normal. If they're elevated, you got to kind of take that into consideration too. And it doesn't work quite that nice. But in the perfect world that you're going to be tested over, that's where it has to work. Which of the following is aerobic? There's only one. What's the fuel source in glycolysis? Carbohydrates. Blood pressure, 93 over 60 in an 8-year-old.
Okay, let's slow down.
Sorry. That one you just had to have, you had to know those blood pressures of the kids. And are you doing peds right now in rehab?
No.
Y'all don't call it rehab, you call it procedures too, don't you?
Yeah, we're doing cardiac rehab.
Isn't there, isn't it per child, isn't it like, what is the,
100 over 60 is normal. So, it's normal. That's the top range. You are having your shoulder patient externally rotate from the neutral position against resistance, and there is no movement. What is it called, Amy? That's right. Having your patient use a TheraBand to improve strength of the dorsiflexors. Which of the following is true? The patient will have a concentric and an eccentric of the dorsiflexors. Remember, it's one muscle that's going to get both contractions. I threw this question there, 20 and 36, so over half the class did not get this correct. And this is another one that I need you guys to know. Eccentric, concentric, same muscle. Remember the bicep, and I said you lift the weight, that's concentric, and as you lower it, that's eccentric. It didn't change the tricep, did it? It stays in the bicep. And so you've got to know what eccentric means, because eccentrics are a big part of what we want to do for our patients. A patient is performing side lying hip abduction. Here's another one. Which of the following will perform an eccentric contraction during this movement? Well, what's a muscle that's doing hip abduction? The tensor fasciae lata.
I read that one wrong. Like I thought it was asking that.
Look for gluteus medius first, and you didn't have it.
Well, I did, just on the other side.
That's why I didn't pick it, because it said left.
Oh, yeah.
Yeah. Yeah, and this question is something that's very similar that came off my exam, my licensure exam. I mean, I remember very clearly a lot of questions, and this was one of them. And what I thought was so ironic was that glute med on the left side.
I was trying to get
I mean,
you. See blue me.
I just want you to know, I don't design this test, well, is he recording, he said? To piss you off. That is not my intent. What it is, my intent is to clearly let you go in there and deal with these things and feel kind of tricked, but also have some time to deal with it, where you can recover here, because we're gonna let you recover here. That thing over there, you pay $500, $600, it was $682 for me to get all my stuff in to take that test one time. That's a big investment, and I don't want you to have to do that multiple times, and you don't. Like every time after that's like 75, but still, once is enough. I want you to recover here and be able to go in there.
Spend that $75
You'd have a
on
valve
celebration
salve on
dinner.
that, wouldn't you? Blood
I told
pressure
you.
might be a little bit up after
I am
that.
very interested in you being prepared for this thing. I'm not kidding. This was the worst one of all of them that I took. Resting heart rate will not take any long-term adaptations to exercise. Amy asked that right before we took the test. I'm so proud. A patient is strengthening their shoulder abductors, which of the following is an agonist? The deltoid. Again, look at them and go, subscapularis, pec major rhomboid, deltoid. There's only one involved in abduction. That's an agonist, not an antagonist. The rest are antagonists. The rhomboid's really nothing in there.
Can we make fun of Doug for picking the wrong board?
Was me. Anyways, this right here is a little misleading because, I mean, that takes for the whole range, and then it gives me an average, so, I'm okay with that. I know that there's a lot of folks who are like, okay, listen, I didn't score too well, what's this do to me? Well, it does one thing, and that is, it sets you up to say, okay, I need to focus on, you know, being more careful with my content, reading it, but just using it. And now I've kind of given you some examples of how to use it. But the biggest thing is going from here and saying, the next thing is stretching. Well, I told you, active range of motion, passive range of motion, active assisted and stretching. And that's a lot different content. I mean, what you're gonna deal with there are words like agonist, antagonist, eccentric, concentric, and you're dealing with the stretches and the positioning and things like that. And
Like, in Bill's, I like agonist, and this ain't gonna mess me up with it, agonist and agonist. I like agonist as the one contracting, and agonist as the one relaxing.
yes,
Is that okay? But somehow in my notes, I had lengthening and shortening, and, you know, sometimes the agonist is lengthening on the eccentric, you know,
on the eccentric it is lengthening, yes.
so.
And that's what makes things hard. You gotta know what it is you're dealing with.
So is there like the ones I got right?
I'm gonna relax, not do nothing now.
Well,
I'm going with Val Salas anymore.
Yeah.
I don't know, I'm about to study out my neuro stuff.
I
No,
know.
I
Cram
feel
as
like-
much in there as I
I'm
can.
just
You guys have your own tomorrow?
Yeah.
Neuro's more.
Neuro
We're gonna,
what over?
Neuro.
Well, I mean, what's
Uh,
Brain.
Brain supply, blood supply to the brain.
shut the neuro.
CNS.
CNS.
Look, I'm jumping in the.
Upper motor neuron, lower motor neuron.
blood supply?
Yep, let's go.
I did see her making that one today. That's,
So when you throw these out, you just basically you're throwing 4 out, so it's gonna be like a 36 question test. Is that kinda how that works?
So out of 36.
and so what happens, your average will go up. Jade.
Unless you got all those right.
So I did get all of those right.
I did too.
So.
Well, then what I may do is I may get them all worked out.
You didn't get all of them right, but one nobody got.
Besides that one, I made that.
And then the other
Looks
one,
like,
Uh,
wait a second.
No, the
100%.
only like
Hey.
5% of people got right, I actually got that one right, so.
Which one of you people?
I was using my 17 earlier.
That's an Annie McBride move right there. It says
Oh,
for
come
Annie
on.
McBride, you get it coming out of my shell.
She's like, well, I didn't have to squat down.
No, no,
There's a 6.9 out there. explaining all that, that helped a lot.
Hang in there, you're fine.
That's what my wife says.
What sucks is you have to spend the majority of the time learning how to take the licensure and not as much as being a good physical therapy assistant.
I know, and that's
You know.
what I gotta, I'm trying to.
I mean, you gotta balance
both.
it, but it's like,
But
you've
it's
got to pass the licensure or else you don't get to be a PTA.
I know, and that's my big thing is how do I get y'all prepared for that, but also like to know how to deal with patients. Just, that's kind of an important thing to me is.
Yeah. Okay. That's the thing I'm worried about getting into clinicals is like, you know, all this book stuff, you know, I know, but as far as practical,
Listen,
I mean,
clinicals are a blast. You'll be like, let's do this a lot. I wish we
it's the
could do
easy
like
part.
a lot more of them. That's my thing. Let's treat that.
My biggest fear is getting in there and not knowing what the heck I'm doing. You know?
Oh yeah, you'll definitely not feel that until like on your 5 weeks.